Hello all, today I am going to discuss about the topic of retina. Introduction. The retina, which is an innermost unit of the eyeball, it is a thin, delicate and transparent membrane. Its thickness is about, at the posterior pole it has 0.56 mm and at the equator 0.8 to 0.2 mm. At the ora serrata it is approximately 0.1 millimeter. It is most highly developed tissues of the eye. It appears as a purplish red in color due to the visual purple of the rods. After the death, the retina appears as a white opaque color. The gross anatomy, the retina extends from the optic disc to the ora serrata and has a surface area of about 266 square millimeter. It is mainly divided into three distinct regions: optic disc, macula lutea and the peripheral retina. Optic disc, it is a pale pink, well-defined circular area of about 1.5 mm diameter, and at the optic disc all the retinal layers terminate except the nerve fiber layer, which passes through the lamina cribrosa to run into the optic nerve. In comparison to the rest of the retina, the optic disc appears white, lamina cribrosa and medullated nerve fibers behind it, and the absence of vascular choroid. The optic disc, in the center, where the nerve fibers are the thinnest, the white lamina shines more brightly. The grey spots in the lamina are to the non-medullated nerve fibers, reflecting less light than the white connective tissue fibers. The physiological cup of the optic disc is a depression seen in it. The central retinal vessels emerges through the center of this cup. The increase in the size of the cup and the difference in the size of the two cups should be watched suspiciously to rule out the glaucoma. Macula lutea. The macula lutea yellow spot is comparatively dark area which is 5.5 mm diameter, situated at the posterior pole of the eyeball. It is temporal to the optic disc. It is an horizontally ellipsed area demarcated approximately by the upper and the lower arcuate and the temporal retinal blood vessels. It corresponds to approximately 15 degrees of the visual field, and it consists of the photopic visions and color vision. These are the primary functions of these macula lutea. Again, the macula lutea consists of fovea centralis, foveola, umbo, foveal avascular zone, parafoveal area and perifoveal area. The fovea centralis or fovea is a central depressed part of the macula, 1.85 mm in diameter, 0.25 mm in thickness. It corresponds to the 5 degree of the visual field and it is the most sensitive part of the retina. Foveola, 0.35 mm in diameter. It forms the central floor of the fovea. It is situated about 2 disc diameter away from the temporal edge of the optic disc and about 1 mm below the horizontal meridian. Umbo is a tiny depression in the center of the foveola which correspond to ophthalmoscopically visible foveolar reflex seen in most normal eyes. The loss of the foveolar reflex may be seen as an early sign of the damage. The foveal avascular zone, it is located inside the fovea but outside the foveola. Its exact diameter is variable and its location can be determined with the accuracy only by the fluorescein examination. The parafoveal area is like a belt that measures 0.5 mm in width and surrounds the foveal margin. Perifoveal area, it surrounds the parafoveal area as a belt that measures 1.5 mm in width. The peripheral retina can be divided into 4 regions: near periphery, mid periphery, far periphery and ora serrata. The near periphery is circumsed regions of about 1.5 mm around the macula. The mid-periphery occupies 3 mm width zone around the near periphery. The far periphery, they extend from the optic disc 9 to 10 mm on the temporal side, 16 mm on the nasal side in the horizontal meridian. The peripheral retina consists of ora serrata. It is a serrated peripheral margin where the retina ends and the ciliary body starts. At the ora, the sensory retina is firmly attached to both the vitreous and the pigmented epithelium. 2.1 mm wide temporally and 0.7 to 0.8 mm wide nasally. Its distance from the limbus is 6 mm nasally and 7 mm temporally. It is located 6 to 8 mm away from the equator and 25 mm from the optic nerve on the nasal side. This is a microscopic structure of the retina. The retina consists of 10 layers and it consists of 3 types of cells. The first layer is retinal pigmented epithelium, layer of rods and cones, external limiting membrane, the outer nuclear layer, outer molecular or plexiform layer, inner nuclear layer, inner molecular or plexiform layer, the ganglion cell layer, nerve fiber layer and the internal limiting membrane. The first one is retinal pigmented epithelium RPE. It is the outermost layer of the retina. It consists of a single layer of hexagonal shaped cells containing the pigment. The RPE cells shows fine molting, unequal pigmentations of the cells and this is responsible for the granular appearance of the fundus. The retinal pigmented epithelium is firmly adherent to the underlying root membrane, that is the basal lamina of the choroid, and loosely attached to the layer of rods and cones. Thank you.